Imagine this. You're rushing through another busy Monday. You grab a quick coffee, skip breakfast, tell yourself you just need some rest. That's exactly what Sarah, a 38-year-old nurse from Manchester, thought. But one morning, she woke up and her world looked blurry. Her hands tingled. Her mouth felt desert dry. And she couldn't remember the last time she wasn't thirsty. What Sarah didn't know was this. Her body had been whispering warnings for months. Warnings of rising blood sugar. Today, we'll uncover the early warning signs of diabetes, the ones that are often missed, misunderstood, or blamed on stress and fatigue. Through real-life patient stories and scientific insight, we'll see how the body speaks long before a diagnosis. Before we dive deeper, make sure to subscribe to this channel and share this video with anyone who needs to hear this, because what you'll learn today can literally save a life. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone expert. The information has been collected from trusted medical sources, Mayo Clinic, CDC, Cleveland Clinic, diabetes.org, and Yale Medicine. It began for Sarah the same way it does for many, with constant thirst. Glass after glass of water, yet never satisfied. By evening, she was visiting the bathroom every hour. When blood sugar rises, the kidneys try to flush out the extra glucose through urine. You lose water, get dehydrated, and feel even thirstier. That's the first major clue: frequent urination and unquenchable thirst. If you're waking up several times a night to pee or refilling your cup endlessly, it's not just hydration. Your body may be signaling sugar imbalance. Now meet Jake, a delivery driver from Texas. I felt tired all day, even after sleeping well, he said. And no matter how much I ate, I was hungry again. When glucose can't enter your cells, your body runs out of usable energy. It asks for more food, creating hunger even after meals. And since energy never truly reaches your cells, fatigue takes over. If hunger feels constant, or tiredness hits even after a good night's sleep, it might not be your schedule. It might be your blood sugar. High sugar pulls fluid away from the lenses of your eyes. That's what happened to Sherry, an IT professional from London. Her vision blurred every evening as she stared at her laptop. Her optician saw swelling in her eye lens, a typical diabetes-related change. And that persistent dry mouth? It's your body diverting water to handle glucose overload. If your eyes blur on and off, or your mouth always feels dry, listen carefully. Your body is struggling to balance sugar and hydration. Then came Lisa, a shop owner from Chicago. A small paper cut on her finger refused to heal. Even after weeks, high blood sugar damages blood vessels and weakens immunity. Wounds take longer to close. Infections, especially skin, gum and yeast infections, have become common. Women may face repeated vaginal infections, while men may notice jock itch or fungal skin rashes. Dry, itchy skin, especially on the lower legs, is often an early outer sign of internal sugar damage. For Tom, a 29-year-old chef, the warning came on the scale. He was eating more than ever, yet losing weight fast. When the body can't use glucose for fuel, it starts burning fat and muscle instead. That causes unexplained weight loss, seen often in type 1 diabetes. In type 2 diabetes, insulin resistance can do the opposite, causing slow, steady weight gain that's hard to control. If your weight changes dramatically, up or down, without reason, it's time for a blood test. David, an accountant from London, woke up each morning with a pins and needles feeling in his feet. Soon, it spread to his hands. That tingling or numbness is an early form of nerve damage called diabetic neuropathy. High glucose levels silently harm the tiny blood vessels that feed your nerves. And it doesn't stop there. Mood swings, irritability, or brain fog can follow. Because when sugar levels fluctuate, so do your brain's energy and hormones. If your hands or feet feel numb, or you feel uncharacteristically moody, don't brush it off as just stress. It could be your nerves signaling distress. Some early symptoms are subtle, but critical. Persistent dry, itchy skin, dark velvety patches around the neck or armpits, called acanthosis nigricans, a sign of insulin resistance. Frequent urinary infections, digestive issues like bloating or constipation, morning headaches, and even sexual difficulties, such as erectile dysfunction, can all point toward unbalanced blood sugar. If several of these symptoms appear together, it's your body pleading for a glucose screening. Diabetes rarely announces itself. It starts quietly, with thirst, tiredness, blurred vision, slow healing, or tingling feet. Each small symptom is a message, a whisper for help. If any of these signs sound familiar, ask your doctor for a fasting sugar or A1C test, because catching diabetes early can prevent heart disease, kidney failure, nerve damage, and vision loss. Your body always speaks, you just need to listen. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone expert. Information collected from Mayo Clinic, CDC, Cleveland Clinic, diabetes.org, and Yale Medicine. If you found this helpful, like, share, and subscribe for more real-life medical stories that help you stay a step ahead of illness.